Hello, there are a number of ladies in my menopause Facebook and LinkedIn group who have had cancer in the past and have been advised against taking HRT, but nonetheless they're having quite serious problems with their menopause symptoms. And I know there's a lot of confusion and a lot of misinformation out there around whether it's safe to take herbs after cancer and whether they might interact with other medications. So I just wanted to try and clarify that briefly as best I can. Obviously, this is in a very generic kind of context because everyone's different. Everyone's regimes and drug regimes are different as well. So I'm not offering individualized advice, but just general advice here. So the short answer is, if you are unable to take HRT and you are struggling with your perimenopause symptoms, prescribed herbal treatments are absolutely safe to take in those circumstances. By prescribed, I mean herbal remedies that have been prescribed by a medical herbalist following a proper consultation with you, where we take your full case history so we know everything there is to know about your health from birth up to the present day. And what we're doing is looking at the big picture with you and your health overall, and then fitting your menopause symptoms into that context. So we never treat just the menopause symptoms, just the headaches, just the hot flushes, or anything like that, because we're treating you and the underlying causes behind those symptoms, if that makes sense. When we use that kind of approach, there's actually tons of scope in terms of what we can do, and medical herbalists are trained to make sure that the treatment that we give you is not going to interact with any other treatment that you're having at the time. So we have ways of checking for herb-drug interactions, finding out which herbs we shouldn't be using and which herbs we can safely use with you. So in that way, it's a very safe form of treatment to have. Not only that, if you have had cancer in the past, obviously you have issues with chronic stress, because everyone in that situation does. It's a very stressful situation to find yourself in, and it normally lasts a long period of time as well. So that inevitably is going to have an impact on your hormones and your reproductive health. And the other nice thing about working with a medical herbalist is that we don't just offer herbs, we offer lifestyle advice, dietary advice, moral support, advocacy, and anything else you might need as well. So I hope that puts your mind at rest. It is safe to take herbs when you've had cancer, but it is always best to work with a practitioner if you're able to do so, because there is the potential for herbs to interact with other medication that you might be taking. If you would like to ask me any questions, or if you've got any comments, please do get in touch. I'm Hannah from Physic Health Consulting. You can contact me via my website, which is at www.physichealth.uk. I'll see you again soon.